What if I told you that a catastrophic, life-altering ischemic stroke does not simply strike out of absolute nowhere like a sudden bolt of lightning on a perfectly clear day? Instead, what if the true, clinically proven medical reality is that your brain's intricate vascular network almost always attempts to scream for help, broadcasting clear, highly specific neurological emergency signals up to 24 hours before a major blood clot ever completely clamps off a cerebral artery? What if that momentary, strange stumble in your living room, that sudden, brief blurriness in your left eye that cleared up after 30 seconds, or that mild, unusual tingling along the side of your face was not just a passing sign of fatigue, but a definitive ticking clock warning you of an impending neurological crisis? For millions of older adults over the age of 60 and 70, the terrifying fear of a sudden stroke is a constant, heavy shadow that darkens their retirement years. We all know the devastating aftermath, the sudden loss of independent mobility, the permanent paralysis of one side of the body, the heartbreaking struggle to speak basic words, and the total reliance on family members for daily survival. It almost always arrives under the guise of ordinary aging. You are sitting at the kitchen table and your hand drops a coffee mug. You laugh it off, bend down to pick it up, and assume your grip is just loosening with age. A few hours later, you experience a sharp, throbbing headache unlike anything you've felt before, but you simply swallow 2 pain pills, lay down on the couch, and close your eyes. Your immediate instinct, and the instinct of most families, is to wait and see if the passing numbness or subtle speech slip clears up on its own. You don't want to cause a panic, you don't want to rush to an emergency room unnecessarily, and you accept the dangerous misconception that if a symptom disappears within a few minutes, your brain is perfectly safe. But as a physician specializing in restorative vascular medicine and acute neurological longevity, I am standing here today to completely shatter that passive narrative with absolute, unassailable clinical evidence. Your brain tissue is exceptionally fragile, consuming 20% of your body's total oxygen supply. When a microscopic blood vessel begins to choke, you do not have days or weeks to react. You have a critical, narrow window of biological time to intercept a disaster. Every single second your brain experiences microvascular occlusion. Nearly 2 million delicate neurons dry up and die permanently. Long before a full structural blowout occurs, your system drops subtle clues, known in advanced neurology as transient ischemic attacks, or TIAs, literally, the mini-strokes that act as a direct blueprint for a future catastrophic event. But hours of untreated arterial stiffness, blood viscosity stagnation, and full-body fluid back pressure have left these early warning signals completely ignored, leaving your cerebral grid on the absolute brink of an emergency shutdown. Today, in this comprehensive, unified medical masterclass, we are going to completely tear down the walls of misinformation surrounding stroke prevention. We are going to isolate the exact physical and chemical bottlenecks that choke your cerebral channels, examine the underlying vascular dynamics, and put a doctor-approved lifestyle defense protocol into immediate action. I am going to reveal the exact clinical indicators of what a stroke looks like 24 hours before it strikes, show you a highly strategic home physical sequence engineered to decompress your carotid arteries, and detail the targeted organic drink parameters you need to instantly thin blood thickness naturally and clear the arterial pathways. Before we uncover the profound neurological mechanics of these early warning signs, if you want to shield your brain health, protect your independent mobility, and defend your life against a sudden vascular crisis, please click that subscribe button below and turn on the notification bell so you never miss another senior health masterclass here on the Dr. Robert channel. To truly understand how to spot a stroke 24 hours before it hits without living in a state of continuous panic, we must first analyze the exact trajectory of cerebral vascular deceleration that takes place under the surface of an aging frame. If you are completely ready to master your body's neurological alerts, flood your delicate brain cells with clean, pressurized circulation, and secure absolute peace of mind with me today, please type 1 in the comment section right now. If not, Drop a 0 so I can learn exactly how to tailor these deep clinical masterclasses for your specific longevity goals. Let's look past the skull and examine the raw physiology of your cerebral pathways. Blood enters your skull through two primary arterial systems, the vertebral arteries running up the back of your neck and the massive common carotid arteries tracking up the front. At the base of your brain, these vessels merge into an elegant circular highway system known as the Circle of Willis. This structural ring is nature's brilliant backup plan. It ensures that if one artery experiences a minor clog, blood can redirect smoothly from another channel to keep your memory centers, motor controls, and vision centers continuously nourished. However, as we step past age 60 and 70, modern lifestyle patterns place our cerebral circulation into what I refer to as the carotid bottleneck. It begins with the hours we spend sitting completely motionless inside deep living room chairs, with our necks tilted forward watching television or staring down at mobile screens. This chronic forward head posture physically compresses the delicate cervical pathways, dropping blood flow velocity up to your head to a sluggish crawl. Because your large peripheral muscles are silent, your body's built-in hydraulic pumps go completely offline, allowing thick, unoxygenated metabolic waste to pool inside your venous channels. This stagnation creates a dangerous biological state inside your cerebral vessels. At the exact same time, a parallel molecular disaster is taking place inside the vessel walls due to advanced glycation end products, or AGEs. When excess processed sugars and industrial sodium saturate your bloodstream, they bind permanently to the flexible elastin proteins lining your inner brain arteries, turning them into rigid, tough strands of collagen. This sticky sugar crust completely blinds your endothelial cells, forcing them to stop producing nitric oxide, the master gas required to dilate your vessels. Your brain arteries stay narrow, clamped down, and heavily prone to collecting microscopic traveling blood clots. When a tiny cluster of platelets or a fragment of cholesterol plaque breaks loose from a hardened carotid wall, it travels upward into the narrowing microcapillaries of your brain. If the vessel is stiff and clamped down, this clot temporarily jams into place, starving a tiny pocket of brain tissue of oxygen. This is a mini-stroke. Within minutes, your body's natural enzymes may dissolve the clot, restoring blood flow and causing the symptom to vanish. But your endothelium has just fired its ultimate warning flare. If you ignore that passing symptom, the large, definitive blood clot is quietly organizing behind it, ready to clamp the main highway completely shut within 24 hours. We have exposed the structural enemies, the mechanical carotid bottleneck dropping your cerebral blood velocity, and the sticky molecular sugar crust paralyzing your endothelial relaxation. While we analyze the specific 24-hour warning symptoms, we must first put our physical framework into immediate mechanical alignment right here in the room. Many older adults assume that if they want to improve brain circulation, they must engage in high-impact neck movements or dangerous stretches that strain their sensitive cervical spine. But in advanced restorative medicine, we understand that forcing a starving cerebral network to move under sudden load before unlocking the lower peripheral reservoirs is an immense clinical error. Today, I am going to reveal our highly strategic, low-impact, 5-move at-home mechanical realignment protocol. These targeted movements are specifically engineered to bypass neck strain entirely, activate the massive muscular hydraulic engines embedded deep within your lower limbs, and safely decompress systemic vascular pressure to optimize smooth cranial blood flow. All you need is a firm kitchen chair, a clear wall, and less than 10 minutes of daily attention. Let us break down these 5 corrective movements with absolute clinical precision. Movement 1. The seated soleus hydraulic second heart pump. This is our primary weapon to eliminate lower leg fluid stagnation and instantly activate the deepest circulatory engine in your lower limbs. The soleus muscle, located deep beneath your main calf muscle, contains a massive web of dense venous reservoirs that modern cardiology refers to as the second heart of the human body. By pumping this lower engine, we safely pull pooled blood out of the lower extremities, relieving the heavy hydrostatic back pressure pushing up against your carotid pathways. Sit completely tall right at the front edge of your firm kitchen chair. Do not lean your spine back against the comfortable cushioning. Hold your head high, roll your shoulders back, and pull your shoulder blades together to align your posture. Place your feet flat on the floor directly beneath your knees, keeping them perfectly hip-width apart and pointing straight ahead. Keeping the balls of your feet and all 10 of your toes completely glued flat to the ground, slowly and intentionally drive down through your midfoot to elevate both of your heels high into the air. Raise them up until you feel a deep, tight contraction, locking along the lower half of your calves. Hold this peak contraction for 2 full seconds. Now, lower your heels back down over a 2-second count, touching the floor silently. The exact split second your heels touch, immediately peel your toes and the front of your feet up toward your shins, as high as humanly possible, locking the muscles along the front of your shins. Hold for 2 seconds. Alternate back and forth continuously for 90 full seconds. Repeat for 3 total rounds daily. Movement 2. The countertop bamboo Achilles tensor. This movement targets the thick, rigid tendons running down the back of your lower ankle, which act like a physical constriction band that bottlenecks blood flow returning from your feet, driving up systemic systolic numbers. Stand completely tall and proud facing your kitchen counter, a solid table, or a flat wall. Place both of your hands flat on the surface at chest level to serve as your absolute balance security button. Step your right foot backward about 18 to 24 inches, keeping your left foot forward. Keeping your rear right heel completely glued flat into the floor and your right leg perfectly straight. Slowly bend your front left knee and shift your entire torso forward toward the counter. Move forward until you feel a deep, intense, warm lengthening stretch, stretching all the way down your right Achilles tendon and upper calf. Once you reach that point of deep stretch, do not bounce. Hold the position in absolute stillness. Take a deep 4-second breath in through your nose, expanding your stomach, and as you slowly exhale through pursed lips for 6 seconds, baby your system into deep relaxation. Hold for 30 continuous seconds per leg. Complete 2 rounds per side. Unlocking this ankle bottleneck instantly drops systemic vascular tension. Movement 3. The seated femoral highway unkinker. This movement is specifically designed to address the mechanical kinking that occurs inside your hip creases from spending long hours sitting in soft recliners, which completely shuts down blood velocity through your massive femoral lines and traps volume away from your upper chest and neck. Return to your tall, seated position at the front edge of your firm chair. Grip the metal or wooden side frames of the seat tightly with both hands to stabilize your pelvis. Keeping your posture long and your chest proud, slowly elevate your right knee upward toward the ceiling about 4 to 6 inches clean off the ground, exactly like performing a slow-motion march. At the absolute peak of this movement, flex your foot by pulling your toes back toward your shin and hold your legs suspended in mid-air for 2 full seconds. Do not let your foot drop or slap back down unguided. Lower it down with immense control over a 3-second count, placing the sole flat on the floor like you are stepping onto thin ice. Immediately alternate to your left leg. Execute 10 slow, calculated marches per leg for 2 full sets. This clears the fluid logjam in your lower torso, opening the vascular pathways. Movement 4. The lateral wall-supported pelvic brace. This exercise activates your outer hip stabilizers, specifically the gluteus medius, which control the alignment of your pelvis and prevent your body from swaying side to side. A primary trigger that causes your sympathetic nervous system to panic and clamp down your carotid paths. Stand tall sideways next to a flat wall or your kitchen counter. Place your inside hand firmly onto the surface for absolute balance protection. Stand with your feet pointing straight forward, touching each other. Keeping your torso perfectly upright without tilting your shoulders, slowly sweep your outside leg out sideways to the side about 12 inches. Keep your toes pointing straight ahead. Do not let your foot twist outward. Hold this lateral suspension for 1 full second at the peak, feeling the muscles on the side of your hip firing tightly. Slowly bring the leg back inward over a 2-second count until your feet touch. Complete 12 controlled lateral sweeps on one side, then turn around to train the opposite leg. Perform 2 sets. Activating these lateral guards gives your body a rock-solid, stable foundation, drastically reducing the hidden stress that drives up cranial blood pressure. Movement 5. The seated carotid carina deep diaphragmatic release. This final movement targets your autonomic nervous system directly. It gently stimulates the specialized neurological pressure sensors located inside your neck arteries, known as baroreceptors, commanding your brain to instantly dial down its emergency adrenaline output and relax your cerebral arteries. Sit completely relaxed but tall in your chair. Rest your hands flat on your lap with your palms facing upward. Close your eyes down completely. Rest the tip of your tongue gently against the roof of your mouth, right behind your front teeth. Slowly inhale a deep breath in through your nose over a quiet 4-second count. Do not lift your shoulders or puff out your chest. Instead, drive the air deep down into your belly, forcing your abdomen to expand outward like a balloon. Hold that deep volume of air in your lungs for a brief 2-second pause. Now, open your lips slightly and slowly exhale that breath out through your mouth like you are blowing through a tiny straw. Extend this exhale over a slow, continuous 7-second count. As you empty your lungs, feel your shoulders drop and your entire nervous system down-regulate. Complete 8 continuous rhythmic breaths. This activates your vagus nerve, sending an immediate chemical message down your spine to slow your heart rate and open your cerebral pathways safely. Now that our physical framework is mechanically unkinked and systemic vascular pressure is lowered, we must closely analyze the precise 24-hour warning indicators that every senior over 60 and 70 must memorize to catch a stroke before it strikes. These are the subtle, early-stage neurological warnings that appear the day before a catastrophic event occurs. The first indicator is the transient facial drift and asymmetrical grip. This is when you notice a sudden, temporary numbness or weakness localized strictly to one single side of your face or one arm. It may last for only 60 seconds before completely vanishing. You might struggle to smile evenly in the mirror, or find yourself unexpectedly clumsy with your fingers for a brief moment. This is a classic indicator that a microclot is temporarily obstructing the middle cerebral artery, starving the motor cortex of your brain. The second indicator is the brief amaurosis fugax, or visual shade. This is an incredibly specific warning sign where you experience a sudden, painless blurring or total loss of vision in just one single eye. Patients often describe it exactly like a dark window shade being pulled down halfway across their field of view. It typically clears up within a few minutes as the clot passes, but it indicates that a fragment of plaque has just traveled up from your carotid artery and momentarily choked your ophthalmic highway. The third indicator is the sudden, unexplained occipital thunderclap headache. Unlike a standard tension headache caused by dehydration or stress, this is a sudden, sharp, intense throbbing or crushing pain localized to the back of your skull or neck that strikes with maximum intensity within seconds, often accompanied by an unexpected wave of nausea or mild room-spinning dizziness. This means a cerebral vessel is entering a severe vascular spasm under immense hydrostatic back pressure. To complement our physical alignment moves and defend your brain tissue from these risks, you must optimize your morning biochemistry using the Clear Vascular Flush Protocol. Every single morning on an empty stomach, drink a clean 8-ounce glass of pure water infused with a high-potassium extraction of crisp organic celery and a small squeeze of fresh lemon. Celery contains highly active organic phthalides that act directly on your arterial walls, preventing sudden spasms and keeping your carotid pathways soft, flexible, and open. Simultaneously, introduce bioavailable organic nitrates from mustard greens or beets into your daily meals to fuel your endothelium's natural nitric oxide factories, ensuring your blood remains thin, smooth, and perfectly dynamic as it travels through your cerebral capillaries. Furthermore, we must bridge the gap between nutrition and your actual 24-hour daily living environment. Longevity and absolute brain protection are quietly constructed out of safe, repeatable daily lifestyle defenses. To eliminate the high risk of a sudden morning pressure spike that could dislodge a carotid plaque, you must implement the 5-second transition rule the very moment your eyes open. Step 1. The lateral awakening. When you first wake up, do not immediately sit up. Remain flat on your mattress, roll gently onto your left side, and take 3 deep, slow abdominal breaths to allow your baseline heart rate to stabilize. Step 2. The seated equalizer. Slowly push your upper body up and sit completely upright on the absolute edge of your bed frame, allowing your feet to hang down flat toward the floor. Count to 5 slowly in your mind. This 5-second pause gives your neck baroreceptors the exact time window they need to adjust your blood vessel tension against the downward pull of gravity, completely preventing sudden dizziness, blurry vision, and morning falls. Step 3. The priming pump. While sitting on the edge of the bed during those 5 seconds, perform 10 quick rhythmic ankle pumps, peeling your heels up and your toes up. This immediately fires your second heart calf engine, driving fresh blood straight back up to your skull before you stand up. While implementing these powerful natural habits and optimizing your daily nutrition will drastically improve your brain circulation, true medical wisdom requires you to maintain an absolute baseline of diagnostic awareness. You must completely memorize these non-negotiable emergency markers. If you, a loved one, or a contemporary ever experiences any of these acute symptoms, sudden facial drooping, sudden inability to lift one arm, or sudden slurred, scrambled speech, do not attempt to exercise, do not drink celery juice, and do not wait to see if it passes. Stop all activity immediately. Note the exact time the symptoms started, and seek emergency medical evaluation right away. As a critical physician's warning on active plant juicing and medications, because vegetables like mustard greens and celery are rich in bioavailable vitamin K and organic potassium, you must exercise high precision if you are currently prescribed traditional blood-thinning medications such as warfarin or Coumadin. Do not make sudden, drastic spikes or drops in your daily consumption of green extractions, as it can alter your clotting times. Maintain absolute consistency and always consult your primary care physician to tailor your monitoring to your healthy, nutrient-dense lifestyle. Living your retirement with true dignity, supreme physical freedom, and absolute peace of mind means taking total command of your daily biological choices. By fueling your cellular pumps with clean master extractions, keeping your lower leg engines active, and optimizing your home safety pathways, you are securing the independent future you rightfully deserve. Please take a brief moment right now to comment below with your current age and share which room in your home you are going to audit for loose throw rugs or safety night lights first today. Click that like button, share this vital guide with a contemporary who wants to protect their brain health, and subscribe to Dr. Robert to safeguard your longevity journey. Thank you so much for watching. Keep your foundation strong daily, and I will see you in our next video.